Well, look, good evening, everyone. Thanks for joining us tonight for our Q&A webinar. I'm Andrew Gosbell. I'm the CEO of General Practice Registrars Australia. Before we get going, I'd just like to acknowledge the traditional owners of the land on which we're all joining this webinar tonight. So for myself, I'm based in Melbourne, and the traditional owners of my land are the Wurundjeri people of the Kulin Nation. But I pay respect to not only their elders, but also the elders and traditional owners of the lands on which you are joining us from as well, and our panelists are also located. So tonight, if you just excuse me just one moment, while I get myself organised here. Apologies for that. So tonight we have a panel of four who are going to attempt to answer the many questions we've received, both via registration. So thank you for those who've already posed your questions. But also I'd encourage you during the evening to post any comments and questions via the chat box or the Q&A box on the webinar at the bottom of your screen there. During the evening, I'll be moderating them and I'll be posing them to the panel on your behalf. So keep the questions coming. But before we get going, let me introduce the panel. So tonight we've got Dr. Allison Hempenstall, who's the chairperson of the Akram Registrar Committee, and she's working as a rural generalist registrar on Thursday Island in the Torres Straits. In 2019, she was the Akram Rural Doctors Association of Australia's Registrar of the Year, and she's also been awarded a Fulbright Queensland Scholarship to undertake a Masters of Public Health, specialising in global health and infectious diseases in the US. Also, we have Dr. Krystyna de Lange, who's the Registrar Representative on the RACGP board and chairperson of the RACGP's GPs in training faculty. Dr. de Lange is a recent fellow and she's working in an Aboriginal medical service in Brisbane. Dr. Sama Balasubramanian is the current president of GPRA. He's been president since November 2018. He's working as a GP in rural New South Wales and training in sexual health medicine in Canberra. He's also a member of the RACGP's New South Wales and ACT faculty board. Dr. Melanie Smith is a former president of GPRA and is currently working as GPRA's Registrar Advisor, bringing her significant experience with GP training issues and networks in the GP training sector to support GPRA's members who are seeking assistance. She's currently based in Seattle, where she's in the wee small hours of the morning joining us, because her partner's working there. But when she's back in Australia, she works as a GP in Happy Valley, South Australia. So in terms of connecting with us, as I said, please post your questions in the chat box and the Q&A box. If we don't get round to answering them all tonight, we will follow up later, and there'll be details at the end of the webinar on how to connect with us if you have further questions or additional information that you require from us, or if you have a specific inquiry in particular that you'd like Mel as a Registrar Advisor to assist you with. So I'm going to ask the panelists now just to give a brief comment on one or two key aspects of the COVID-19 situation and how it's affecting GP or rural generalist trainees from their perspective, and how their organisations are dealing with these issues and supporting those registrars who are affected. So perhaps to kick things off, I might ask Krystyna, if you wouldn't mind just going first on that one.
Thanks very much, Andrew, and thanks for the introduction. I guess I would start off by acknowledging that the past weeks and months really have been a very challenging time for trainees. Certainly entering and being on a training program in the first instance is a challenging time, but now having to juggle the uncertainty in terms of employment, training progressions, exams, with the challenge of being a frontline healthcare worker during a pandemic, and obviously the personal impact that the virus is having on our lives more generally. It's certainly a huge toll. The gravity of that is certainly not lost at a college level. And, you know, I do feel privileged to be representing GPs in training at this time, and being able to help to advocate and look at ways that we can support trainees. There has been a lot of work going on behind the scenes to try and mitigate some of the uncertainty and unpredictability, and help support trainees through this time. Specifically, the college has been working quite closely with the Department of Health and the regional training organisations to ensure flexibility in training where possible, obviously without compromising the integrity of the fellowship. And, you know, this includes flexibility around what will actually count towards training, the use of telehealth in training, flexibility around supervision arrangements, especially when it comes to telehealth, the ability to access Category 1 leave for COVID-19 related issues and not have that impact on training time, flexibility in training time caps and exam policies and other fellowship requirements. And I guess front of many trainee minds are the college exams, and certainly, you know, I think we'll go into that tonight, I'm sure, in a bit of detail, but certainly, you know, we're working quite hard to look at what options there are to help ensure that these still do go ahead. Probably just wanted to touch on quickly as well, just generally, you know, looking out for the support and wellbeing for trainees more generally, and certainly through the faculty for GPs in training, and also a newly formed GPs in training support COVID response group, which Mel and I have the pleasure of being part of. We're really looking at specific ways to support trainees during this time. And I acknowledge that a big part of this generally is delivering as much certainty and as many answers as we can for trainees, you know, and we've been looking at, or we have been publishing regular updates for the frequently asked questions for the COVID-19 information for GPs in training, and the general coronavirus web page as well. But more outwardly, from a wellbeing perspective, we have just in the last week created a Facebook group for GPs in training to look at creating a place for trainees to connect, and we'll also be publishing a wellbeing calendar for the month of May as well, in terms of looking after mental health during this time. So there is a lot of things happening. I could keep going on in terms of general practice more broadly in the advocacy work that's happening, but I won't keep going. I'll let the others have a say. But I'm looking forward to being part of tonight. So thanks for having me along.
Hey, thanks, Krystyna. And yeah, there's quite a few questions, particularly around exams, so we'll delve into them shortly. But Allison, how are things happening for Akram with the whole COVID situation and Akram registrars?
Look, rural and remote communities across Australia have unique challenges throughout this COVID-19 pandemic. Limited human resources, telecommunications, limited access to PPE, and implication for registrars training are just some of the issues that are specific to rural generalists across Australia. Just like Krystyna mentioned, our college also have been working really hard behind the scenes to ensure that there is adequate support for registrars throughout this time. Some of these things include flexible training policies to support ongoing training, approval of telehealth consultations towards training time, virtual assessments. I think we're one of the only medical colleges in Australia and New Zealand that has been able to seamlessly continue on all assessments virtually, so that there aren't any pauses in registrar training time. Additional registrar wellbeing supports, including the free EAP service that the college provides for all registrars, and then obviously ongoing external advocacy for rural and remote health across the country. And our CEO and college president have been working hard and are in regular communications with the Department of Health and other key stakeholders to ensure that our voices are heard.
Thanks, Allison. Mel, I know that since COVID hit us we've had inquiries going absolutely gangbusters. And if we just talked about the inquiries you're dealing with, we would probably have several hours of webinar. So perhaps if you could just touch on one or two of the really hot issues that you've been dealing with in assisting registrars in responding to COVID.
Yeah, it's been a pretty busy time. Mostly, and probably the biggest issue that I'm seeing registrars really distressed about at the moment is around employment issues, particularly in the context of a lot of falling presentations face-to-face at practices. And so there have been quite a few registrars who've had their hours of work reduced at the request of their practices. We have unfortunately seen some registrars lose their employment altogether. We've also seen there are quite a substantial number of registrars who, because of underlying medical conditions, have been advised by their medical practitioners that they shouldn't be doing any face-to-face consultations, particularly with the limited amounts of PPE available to general practitioners across the country. And so a lot of them have needed to convert to do telehealth either from the practice where they usually work or from home. And while some practices have been really on the ball and been able to sort of pivot to a new model of care really quickly, others haven't and have probably needed a bit more support, and that has impacted on registrar employment and their ability to actually go to work. So they've probably been the biggest things we're facing. There's also a lot of registrars around the country are now looking at what their placement arrangements are going to be for next semester. So there's a lot of concern about availability of placements going forward and even into next year, especially with the current recruitment of new registrars for next year, and registrars who are already in the program are quite concerned that there may not be enough spots for them to continue training, along with all the issues around delayed exams and the impacts that has on sort of people's life plans. So they're probably the big ones that I've been getting.
Thanks, Mel. And Sama, just lastly, I know later on we're going to touch on some questions around what GPRA is doing specifically, but just a couple of thoughts from you in terms of GPRA's involvement in the whole COVID situation and how we're supporting registrars.
Yeah. Thanks, Andrew, and thank you everyone for your comments. I think there are multiple things from our perspective that we're doing to work towards improving conditions for registrars. I think I like to frame this issue philosophically as GP training has always had its issues, particularly around employment conditions and lack of remuneration compared to our other specialist colleagues in training. And COVID-19 has exacerbated existing problems, not only causing new ones. And I think the reality is what we are doing is a bit of a whole systems approach to this problem, not just framing it in terms of what's happening now, which is the very obvious concern of lack of employment, lack of remuneration, and lack of support for trainees at this time. But we're providing ad hoc support through Mel as the Registrar Advisor role, advocating to the Department of Health around policy changes to better support improved funding for general practice training to ensure sustainability of placements and appropriate funding pools for registrars to be able to get access to things such as COVID leave and things that could make us on par with our other subspecialist colleagues. So from my perspective, we've taken the standpoint of things need to change in order for the general practice training experience to improve. And we certainly hear and understand trainees' concerns in terms of finances, remuneration, and equity of employment arrangements. And that's certainly the lens we've taken to the work we've been doing.
Thanks, Sama. Look, we might, and thanks everyone on the panel for those initial comments. We might dive straight into questions. And again, thank you to those who've provided some questions in your registrations, and remind you, if you wanted to add further, please use the chat box. But look, let's kick one off, and this is to the whole panel, and perhaps I'll direct it to Mel to start, and then we'll bounce it across. So for current full-time registrars, how will a reduction in hours or reduced patient numbers impact on their progression through training? So Mel, perhaps from a an employment and training perspective? And then for Krystyna and Allison, what does it mean in terms of, you know, college training requirements?
In terms of employment, a reduction in hours of work is really the main impact is on sort of the bottom line and take-home pay. There's a lot of nuances around how this happens. I've seen some registrars have simply been told, we can't afford to keep you on full time, so we're going to need to drop you back to a couple of days a week, and oh, we've spoken to your RTO and that's okay, so that's how it's going to be for the next couple of weeks, and can you kindly agree to this? Most registrars have kind of felt like they don't really have any choice but to say okay, because the alternative is possibly to have no employment at all. It's in terms of how this is going to affect training, obviously Allison and Krystyna will speak about this more, but certainly the message I'm getting is that that's still somewhat uncertain, and it's probably a bit of an area of policy in progress around what other activities beyond face-to-face consultations or telehealth consultations, or a combination of the two, what other activities might count towards training time. Certainly within the current AGPT policies, there is scope for some other education, obviously mandatory educational activities count towards your training time, but that's kind of, there's quite separate definitions of full-time and proportion of full-time for employment purposes versus the amount of time you have to be doing for training progression. So I think it's important to recognise that separation. Where registrars might be getting into difficulty around their practices wanting to reduce their overall hours for employment, I think there's a number of things that need to be considered, and I would certainly, one of the first would be to make sure that your practice is looking at applying for the JobKeeper payments to help support you as an employee, and perhaps maintain revenue streams or funding streams to keep registrars on at full-time or close to full-time if possible. And then, so I'd probably, in terms of employment, the nuances are tricky and are kind of individually very different, but as I said, I've had lots of different scenarios placed in front of me. I think it's important that if any registrars are asked to reduce their hours of employment, they need to talk have some clear communication with their practice as to why this is required, what the implications are in the short term and in the long term, how they can use any leave accrued, any sick leave or annual leave to perhaps ameliorate the situation. And it's also really important that registrars talk to their RTOs. I'm getting very mixed messages about how much communication has actually occurred between registrars and RTOs, and they're not necessarily feeling as though they're getting all the support they need. So if a practice approaches you wanting to reduce your hours of employment, please make sure you reach out to your RTO, talk to your medical educator or training advisor, talk to your registrar liaison officer, and also let us know at GPRA, and we can help you try and navigate the situation to optimise it for your particular needs. For some registrars, they're quite happy to reduce their time at work, but obviously there's significant financial implications for that, and many registrars are not happy at all to be reducing their hours. But in terms of training time, I'd probably hand over to Allison and Krystyna to talk a little bit more about how reduced hours of work might affect their training.
Thanks, Mel. So Allison, how does reduced patient numbers or reduced training hours impact on progression through the Akram training programs?
I think it's really important to say out front that every registrar is going to have a different and unique experience. And so there is no one cookie cutter approach to this. I'd really strongly recommend that registrars contact their RTOs, for those on the independent pathway within Akram, to contact their medical educator, and all Akram registrars have an Akram training officer, and I'd strongly recommend that you contact them as well, because they'll be able to give you specific advice for your specific situation. In terms of decreased numbers, if you're used to seeing 30 patients in a clinic and that's dwindled down to 20 or 10, the volume shouldn't have a significant impact on your progression throughout your training. Obviously, it's going to limit your experience, and that's something that is unfortunately unavoidable. But in terms of reduced hours, again, it's going to be dependent on your individual employment situation. Many registrars that are training to be rural generalists work in both the primary care sector, but also within a hospital. And so they might be able to pick up a few more shifts in emergency if their primary care work is reduced. You also have the option of dropping back to a part-time training if your hours fit part-time load. Even though that would potentially extend your training time, it is an option to keep your training ticking over. If you're undertaking your advanced specialist skill, it may be one where there is a research project component of it, and this might be a really nice time that you have a little bit more time up your sleeve to tap away at that. And then, of course, things like additional education and simulation activities that your hospital or your practice are undertaking. It's really important to be documenting those as well, because they can contribute to your training time. But like I said before, it's going to be very individualised depending on your circumstance. So I'd recommend that you contact that Akram's training officer and your RTO.
Thanks, Alison. And Krystyna, from an RACGP perspective, I mean, we've actually had some inquiries where trainees have said, well, my practice manager says that the RACGP is not going to sign off my training time because my patient numbers have dropped by 30 or 40%. Is that true? And what's the RACGP position in terms of, you know, patient numbers and training time and the potential impacts of COVID?
Yeah, thanks, Andrew. And some very valuable comments already made there by Mel and Alison. Certainly, a reduction in hours may impact on full-time training status. The RACGP does have a specific policy, the vocational training pathway requirements for fellowship policy, if anyone wants to have a look, that does specify that full-time training comprises a 38-hour work week. However, it does state in there that it's a minimum of 27 hours face-to-face rostered patient consultation time. So certainly that can be made, that full 38 hours can be made up out of sort of, you know, the educational release and in-practice education and administration time, etc. Certainly if your work hours are to drop, you know, the total work hours are to drop under 38 hours, then this is going to potentially have an impact. Like Alison said, you know, there is the option of dropping down to part-time training if that's the registrar's preferred choice. There may be some trainees at the moment that is their preference at the moment, but acknowledging that that's not going to be the case across the board. Certainly one option to try and avoid, obviously discussions with the practice to try and come up with some more creative ways of how you could be I guess, best utilised in the practice if patient numbers have reduced significantly. You know, trying to look at options in terms of patient recalls, you know, management plan, obviously above board, you know, recalls around management plans, checking in on patients, you know, that are known to have mental health conditions that might be at risk of deterioration at this time. You know, so I think actually there is an option for the trainee to try and negotiate with the practice around how they can try and maintain their employment. But also another option would be to actually couple their current general practice work with another role. And certainly the college has provided some guidance to RTOs in terms of what roles might contribute to training. It is hard to make a generalised statement like Alison sort of alluded to. It's kind of not cookie cutter approach, one size fits all. There is a bit of nuance in terms of the stage of training, where you are in terms of exams, your overall progression through training. But there may be the option, for example, if your general practice had dropped your hours, to pick up some time in a fever clinic or a respiratory clinic or a hospital emergency department, or even a different role, that, obviously with discussion with the RTO to ensure that that would still contribute to training. But that would certainly be something that would be an option. And I'd encourage trainees in that position, after they have ruled out that they also want to drop down to part-time, they've attempted negotiations with the practice and that hasn't gotten them anywhere, to really touch base with their RTO if they're wanting to maintain that training status, to be able to look at alternative options. I guess in terms of the perspective of reduced patient numbers, I'm happy, Andrew, for you to forward to me any registrars that are saying specifically that RACGP is saying that they're not going to count training with the reduced numbers of patients. If anything, that's going to be coming from an RTO level at this stage. Certainly, like Allison mentioned, patient numbers we don't have a minimum patient numbers in order to count towards training. Patient numbers are monitored to ensure that registrars and trainees are having a valuable training experience. So we know that you need to be seeing patients to be able to actually learn and to progress through training, but we certainly don't have any specific cutoff that under a certain number of patients that no longer counts towards training. It would more be the RTO monitoring that to ensure that that practice, it continues to be a viable practice for trainees to attend. So certainly, I wouldn't imagine that would be, but I'm happy, as I said, I'm happy to talk to anyone in that situation, but I wouldn't imagine that would be a specific block. Certainly though, the college has been looking at options for trainees who choose, who actually are themselves are concerned about the drop in numbers, and even if that hasn't impacted their training hours, so the practice is still maintaining their current training hours, but they're actually seeing significantly less patients. If the trainee themselves is actually worried about how that's going to impact their exam eligibility, their exam readiness and their readiness to fellowship, there may be options for that trainee to, opt for an extension to their training time to try and help for them to still get that experience. As far as I am aware, I don't know that the RTOs, are specifically penalising trainees at the moment for reductions in numbers, but happy to be included in any specific cases there.
Thanks, Krystyna. And Sama, look, from what Krystyna and Allison are saying, it's one of the key themes is, trainees need to get proactive and engage with their RTO and college on some of these issues, so they're clear on what they need to do next. But from your perspective, what other sort of flexible solutions and options are available for trainees to retain their current positions, or being able to move to another location to sort of avoid disrupting their training too much?
So I think there are a couple of things, and thank you, Krystyna and Allison, for outlining so eloquently what the situation is. I think what's important is we need to understand that there are other things that can change within the RTOs that enables a difference in placements. For example, we've been having discussions with RTOs around if a registrar is having decreased hours in one practice, is there a possibility of opening up a slot at another training practice for X number of hours in order to accommodate them where the work is available? Certainly in terms of access to fever clinics, etc., we've discussed that, so that is an option, as well as some hospital work as well. In terms of the dialogue around what that means for your training experience, where you go from there, it is very nuanced. And and I would encourage all registrars to actually have that discussion with their medical educator in advance of any of these circumstances happening. What we will find as the pandemic wears on is that there's an initial wave of registrars that are affected, and people get progressively affected as that financial viability of the individual training practices changes over time. And that's where the uncertainty comes into it. We really need to manage that uncertainty by having proactive discussions with our medical educators and the training organisations now, in order for all the different stakeholders to help registrars best. So it's a conversation now if you're not having problems, and it's a conversation now if you are having problems. But it is a bit nuanced in terms of what the solutions are, and they're not all immediately apparent to us.
So Sama, that sort of leads on to sort of a really important question around the availability of places going forward. And we had a specific question on that came through on the email registration around availability of places in the Sydney region from a registrar working out of Synergy. But I want to sort of take it a little bit broader because I really am interested in views from yourself and other panellists around the availability of training places for the second half of this year and into next year.
So there are a couple of elements, particularly in terms of the point two or the second term placements. One thing we know traditionally across the board from all RTOs and the training experience is certainly that's a time when many registrars do things like their extended skills term. What's happened to that is difficult to say, but often we experience a natural lull in terms of the number of placements that are actually required. I suspect that may not actually be the case this year given the situation. I think what's very clear is there are a few levers to pull within RTOs and other organisations that may be able to open up placements and make areas available. And I think we all need to be flexible around what kind of work is actually going to happen. An initial plan of doing full-time at a particular practice may not actually work, but there may be the option of doing part-time across two different practices. So I think there is a degree of flexibility needed, and I think everyone's sort of on board to try and make that work as best we can. And it's about finding the best quality training experience for trainees now within the situation that we've got, the hands that have been dealt. But I'm happy to pass on to Krystyna or Allison if they have any comments from a college perspective.
So Allison, is there going to be issues with the placements from an Akram perspective? Or is there still a desperate need for rural generalists and rural registrars?
I think, Andrew, there will, for a while or many years to come, there will be a desperate need for rural generalists across Australia. Most registrars have year-long placements. So unlike my RACGP colleagues, the terms or the employment conditions are a year long, so most registrars should not be affected. Those that are in a hospital year, again, should be continuing on with their hospital year, and those that are doing their primary rural and remote time or advanced specialist skills outside of the hospital setting, for the majority will be in a year, at least a year long contract. So it's something that we have yet to come across, but I'm very happy to be emailed by any registrars who might think that this will be implicating them.
Thanks. And Krystyna, so how's the RACGP viewing this? And perhaps it's a dynamic between the RACGP and the RTOs.
Yeah, that's exactly right. I mean, it is definitely a dynamic between the two, between the RACGP and the RTOs. And I think RTOs are monitoring the situation quite closely in terms of the availability of training placements, and certainly working with training practices to ensure there are adequate numbers of placements moving forward. Certainly I think it will be nuanced in terms of the area and how the impacts, what the specific impacts are having in the particular regions. So it's hard to say at an overall level. There may be some RTOs, and we've already heard from some RTOs that actually have said that they've had no drop off in interest in terms of for 2021 in terms of training practices, and they feel quite happy that they will have adequate placements. So I think it will be nuanced, but certainly for those RTOs where there is concern, I'm not specifically aware of which RTOs at this stage may have that concern. But if there was that concern, then certainly there is the option for, RTOs to look at further practice accreditation if that was appropriate. And certainly, we would be supportive of trainees continuing in their current placements if need be. So, for example, if they did have a 6-month contract and a 6-month training term, there's even been some RTOs that have been encouraging trainees to stay on for the remainder of the year where that's possible for the practice. Certainly, I think it makes a lot of sense at the moment in terms of it would be a challenging time to sort of uproot and leave and go to another practice. So that's certainly being allowed. And I think a lot of people are concerned about the sort of practice diversity requirements and how that might be impacted if they don't move. But certainly the college has released information about that, just reassuring that there is flexibility. That if trainees are not able to meet the practice diversity in terms of moving to a second practice, there will be other ways to demonstrate that practice diversity requirement, and so that, they could, in these circumstances, if they had to stay at the same placement for the entire of their training, they're certainly not going to be disadvantaged by that practice diversity rule.
So, Krystyna, I'm just going to grab a question that's popped up in the chat box here, which links in nicely, and it's around the potential for the RACGP to consider non-clinical placements that are not necessarily academic placements either. Something that in sort of the public health realm, that while it's not necessarily clinical, it's relevant to domains of general practice. Do you think there's scope there? And for registrars wanting to pursue that, how would they best approach that with either their RTO or the college?
Yeah, at risk of sounding like a broken record, I apologise. I think that is a nuanced issue, I guess. Certainly it would need to be looked at in the broader context of where the trainee sits in their training. If they were looking at doing this as part of their extended skills term, for example, if they were already, past their, written exams, for example, if there hadn't been any, if they've been progressing through their training well with no concerns from supervisors, ECT visits, the RTO, then certainly I think that it's reasonable for the registrar to approach the RTO and talk to them. That would be the first step, is to talk to the RTO in terms of what would be, what would be counted. And certainly an option is to, as I think I mentioned before, is to couple this kind of work. So it might be even that, they were able to secure a part-time placement, but be able to do the rest of that, make up the full-time hours doing something else. But it's not an easy answer to just say, yes, that would definitely be approved. Obviously, it would depend on exactly the type of work, whether the RTO felt that non-clinical work was still, going to contribute to their training experience and their competency as a GP, and obviously, the stage of their training as well. But I certainly wouldn't take any of those things off the cards, and I would just encourage them to talk to their RTO.
So what about there's a related question that came through earlier around whether reduced hours could be still regarded as full-time training in some way or other during the COVID period, and whether there could be exceptions that are made by RTO or colleges, or additional activities that could be included. And I know Allison mentioned earlier the potential for simulation and other things that are relevant for rural generalist training. But from an RACGP perspective, Krystyna, is there any room to move on that, do you think, or is that the requirements as they are, and it's more nuanced that would have to be discussed with the RTO?
Yeah, I think, whilst RACGP is obviously working hard to provide flexible solutions, we're not in a position to change major training requirements, such as, you know, overall full-time equivalent training time. It is really important that throughout this we do maintain the integrity of our fellowship and continue to ensure, I guess, that trainees are exam ready and most importantly at fellowship are competent to practice as a GP anywhere in Australia independently. The GP training program is already the shortest specialty training program out of all of the specialties. If we were to reduce full-time hours and I guess recognise sort of part-time training as the equivalent to full-time training, you know, it is going to significantly impact on someone's experience of through their training and potentially their, you know, ability to fellow as a safe practitioner. So whilst we are working very hard to provide flexible and lenient solutions, there are some aspects of the fellowship that will have to remain in terms of maintaining the integrity of the fellowship. So I think certainly though coming up with some, you know, as we've sort of talked about, some creative ways of filling up some of the hours. So certainly, you know, I think, you know, sitting in with a supervisor certainly could be counted towards training if it's part of their working hours. And, you know, would be considered a type of education experience, I guess. Certainly opening up, you know, the ability to use telehealth either on site or remotely to be able to count towards training. And like we've talked about, you know, multiple times, you know, coupling their general practice work with another type of approved work to help to make sure that the trainee can still continue in a full-time capacity. You know, there are going to be ways to mitigate that as opposed to just, you know, a blanket recognition of part-time counting as full-time.
Thanks, Krystyna. So look, a common theme has been talk to your RTO, and I'm just going to pick up something that's come up in the chat box, I think, which is really relevant here, and that is in talking to my RTO, they're just not responding to me, they're being obstructive, then they're not being at all helpful. How do I escalate this? And this is probably a good one for you, Mel, to start off on. What's the next step if the person that I'm talking to at my RTO is just being unhelpful?
Certainly if people are finding that they're not getting the assistance or the clarity of communication they need from their RTO, I'd recommend that they contact the Registrar Liaison Officer at their RTO, who is also a general practice registrar, who can often find the right person for you to talk to in the RTO and can do a little bit of advocacy for you with the RTO. We're also always happy to receive inquiries from registrars who want some advice around how to navigate conflict with their RTO. Sometimes we can provide sort of assistance in the background, giving people advice on the right ways to approach the issue. And sometimes we can actually do a little bit of more direct advocacy and, you know, make some calls ourselves, find out a bit more about the story, and perhaps provide a clearer line of communication between the RTO and the registrar. Certainly, if there is a need to raise a formal complaint, every RTO should have a complaints policy and procedure. So if you have a significant concern about how the RTO's been handling an issue, you can certainly find out what that policy is. It should be published by each RTO, generally on their website, and go through a formal process. But generally that tends to be kind of a bit of a process of last resort, and very often in my experience helping registrars where they have concerns, we can often kind of get to the root of the problem without having to go through the really painful formal processes, just by perhaps escalating up the chain of command in an RTO, finding out the right person to talk to who can actually make the decisions that need to be made or provide more definitive advice on a particular situation. So generally it's, yeah, talk to your training advisor or medical educator, your registrar liaison officer, your RLO, or talk to GPRA are probably your best sort of ports of call in these situations.
Sometimes the challenge is just navigating through the system, and there are plenty of people who can help along those along that pathway. Mel, look, while I've got you there, another question more around an employment issue. So for those trainees who are looking to do some work outside of their training practice, their patient numbers are down, their practice is talking about or has already reduced their hours, can they be restricted from doing that sort of thing? Like if they want to do some locuming, or if they want to go and work in a fever clinic, or just do a couple of ED shifts, is it something that employers can say, no, you cannot do that?
Under certain circumstances, they might, but in general, as a sort of, you know, a fundamental rule, then an employer is generally not able to have a say in other employment you might be involved in outside of your current placement, unless it is having an impact on your current employment. So obviously, if you were working in a practice as a registrar and started doing locum shifts every night so that you were sort of turning up late for work and were too fatigued to be a safe practitioner during the day, there's going to be a problem there. If you're in a situation where your hours have reduced and there's an opportunity to do some other work elsewhere that's not going to impact on your fatigue, it's not sort of bringing your practice into disrepute, I think it's very hard for a practice to say, no, you can't do that. However, there certainly are contracts out there that registrars have signed where there has been a stipulation from the employer that part of the terms of the contract are that you will not be engaged in any other form of employment without first gaining the permission of the practice. So again, it comes down to knowing what your individual employment contract says and thinking about these things kind of at the start of any new employment situation, and being aware that it can have significant implications. Make sure you read all the fine print in your contract. If there is a situation where the practice is concerned about alternative employment you might be involved in outside of your placement, there's generally a reason for them to have concern, and so probably the best way to manage that is to perhaps have a frank conversation with them about what they're worried about. Certainly I suspect there are practices out there who may be saying things like this to registrars because they're perhaps concerned about infection risk. So if they've got a registrar who's on their off days going to work in a fever clinic or in an ED, there may be a perception in the practice that that registrar is therefore putting themselves at greater risk of contracting the virus, or perhaps transmitting it to one of their patients in the practice where they're working on their other days. So probably there needs to be a conversation around, well, is that a fear based in reality? I suspect that most registrars who are going off to work in fever clinics or emergency departments have better access to PPE than they do in their general practice. And they may well be, in fact, a lot safer working in those environments than they are in a general practice that perhaps doesn't have great triage processes and sort of, I guess, infection control processes in place at the practice. So I think if there is a conflict that can't be negotiated between the registrar and the practice, again, that's a situation where you probably need to have a chat to your registrar liaison officer and your RTO or to us here at GPRA. And there may be ways we can kind of mediate that discussion to perhaps open up more appropriate opportunities for the registrar to work. It may be a case of talking to the supervisor or practice manager and I guess managing the risks, clarifying what their concerns are. It might be also worth pointing out to them that if they've dropped your hours of employment, it's pretty unfair of them to then stop you from working elsewhere, and perhaps they need to go back to the original terms of the contract under which they employed you, which I suspect also designated that they were employing you for full-time hours or more than part-time hours, and that if they've dropped your hours, then perhaps they've already broken that contract. And then trying to stipulate a point in the contract that says you're not allowed to work anywhere else is something of a moot point if they've already kind of nullified the terms of the contract. But that's probably getting a little bit into particulars of individual situations that may crop up. But yeah, reach out for support in those situations. Most of the time, I think it can probably be managed and sorted out with a few conversations.
So check your contract first, then reach out for help, GPRA and others. And as Allison has just reminded me too, for Akram registrars, they've got an additional point of call for assistance, and that's their Akram training officers. So that for Akram registrars, the Akram's training officer is there to help you navigate some of these systems issues as well. Look, I just want to move to talking a little bit about telehealth and then some questions on exams. I'm just aware of the time, and I know there were quite a few questions on exams. So we'll just do one question on telehealth and then we'll move to some exam questions. So in terms of telehealth and working from home, it's a particular issue for those who might fall into a vulnerable category. They're immunocompromised, or they have vulnerable individuals in their household. So it's difficult for them to work clinically in practice, but they could still potentially do telehealth from home under supervision. Is this possible, and can it be done under supervision without impacting on their training time? So perhaps Allison and then Krystyna.
I think as Krystyna said earlier this evening, in terms of supervision, that's going to depend on what stage of training the registrar is at, will dictate the percentage of direct supervision that they require. However, I'm sure throughout this time, practices can be flexible, and just as they are seeing their patients via telehealth, supervision can also be done via telehealth as well, or over the phone. So for Akram registrars, telehealth consultations do count towards training time, and a lot of Akram registrars in rural and remote Australia are already quite regularly using telehealth as part of their day-to-day practice. So it's really wonderful that this is now Medicare rebatable, where in the past it hasn't been.
And Krystyna.
Yeah, probably similar from an RACGP perspective. I guess, yeah, we recognise that a significant proportion of consults at the moment are going to be done via telehealth, whether that's on the phone or video, whether it's happening on site or remotely, and very early on, essentially from as soon as the MBS item numbers were released, RACGP has supported trainees' use of telehealth, and also supported that as counting towards training time. Obviously, any use of telehealth, especially if it's happening off-site, we need to make sure that's only happening after complete discussion between the registrar and the supervisor, that both of them are completely comfortable with the method of delivery in terms of the telehealth, as well as the supervision arrangements that are in place. I think that's really important. And, having supervision is important for a trainee, but there are ways to do this if a registrar or trainee is off-site. And certainly the college has really come out and said that as long as there is the ability for the supervisor to dial into a consultation as a sort of third person, to ensure that they can help assess the patient if needed, to support the registrar, then that is adequate supervision. Certainly we would encourage, not every time will they need to dial in. There would obviously be other options in terms of, a quick phone call after the consult, a message through the computer software, emailing like this particular trainee has mentioned in their question, you know, catch-ups during their regular sort of supervisor education sessions to talk through any sort of tricky cases or things they're wanting help with. So yeah, I think there are plenty of options, but it is important that the registrar does feel comfortable with the supervision that's being provided. And certainly for remotely delivered consultations, we are asking trainees and their practices to seek approval from the RTO. Certainly this is not in place to be a block from this occurring, where, as I said, we're very supportive of it, but certainly we want to ensure that both parties are happy with the arrangements and that there is suitable supervision that can be maintained. So we do ask that trainees and their practices put in an approval to have to do the remote supervision.
Thanks, Krystyna and Allison. And just a little plug that GPRA's got some resources around working from home and also supervision planning templates. And there'll be some more information in this week's e-newsletter on that. Let's have a look at exams. I know there's a bunch of questions that we've received, and I'm sorry to those who've submitted them. We won't probably have time to go through each individual one, but we'll try and pull out some of the key themes and follow up later on if your question hasn't been answered. So I guess the big one first up for you, Krystyna, is when are we likely to have the dates for the 2020.2 written exams? And are there contingency plans for next year?
Yeah, sure. So when we initially announced the exam postponements, we were very keen to be able to provide obviously some clarity around when the exams would likely to take place. And, you know, we have been aiming for the AKT KFP 2020.2 written exams to be held around September, October, the 2020.1 OSCE in November, and then the follow-on 2020.2 OSCE in February. I can't confirm those dates at this current time, unfortunately. Obviously it is very complicated by the huge unknowns moving forward in terms of social distancing rules, etc. But we're very aware that we can't necessarily count on knowing about those social distancing rules with adequate time to be able to roll out such huge exams in terms of, you know, the requirements for venues, etc. So absolutely, we are looking at alternative delivery models for exams to ensure that they can still go ahead. So I really hope that within the next I don't want to give any time that I'm then going to disappoint people. So I'm conscious of not sort of putting anything in concrete. Obviously, I acknowledge that people are putting their lives on hold at the moment. You know, they are preparing and, you know, having to try and adapt to new exam dates and, you know, that it's in everyone's best interest to get these confirmed. And I really hope that as soon as possible, we will have some clarity around that. And yeah, just want to reassure everyone that we are looking at alternative models to ensure that they can go ahead this year.
And Allison, so you were saying earlier that Akram have systems in place that make use of telehealth and virtual exams possible. What about for those Akram registrars where that is challenging, where they would really prefer some form of face-to-face, particularly around the stamps exams? Is there any provisions there, or are there any issues or concerns that the college is grappling with in that space?
So Andrew, thanks for the question. Actually, up until a couple of years ago, Akram had all their assessment online, including stamps. So stamps originated being a virtual exam, and we kind of, with increasing numbers and increasing demand, moved to a face-to-face option as well. But obviously the safety of our registrars and their community is paramount, and so at this time it makes the face-to-face unavailable. But Akram have the systems in place to be able to fall back on the virtual video conferencing exam, and all registrars will experience the same assessment experience. Just like in your face-to-face stamps exam, they're filmed, so they will be filmed in this virtual experience. And so if there are any assessment stations that the examiners are unsure of, or the registrars would like to query, then we have a video recording for that option. We have quite a rigorous testing procedure beforehand, so that registrars and their supervisors sitting the upcoming stamps exam in a couple of weeks don't just rock up on the day and then find that their technology isn't working. So that is tested rigorously in the week leading up to their exam to ensure that sound, video and connections are suitable for the assessment. Interestingly, for this upcoming stamps, the time between stamps stations, the preparation time has been extended to allow registrars extra time to prepare.
Thanks, Alison. So back to you, Krystyna. Like, you sort of touched on it a little bit around alternative modes of delivery. So the question from the chat box earlier on was around, how come the RACGP is going ahead with the selection exams, the CAC, but it can't hold OSCE when they're kind of similar? And also from a related question from something that was posted in earlier was around, why can't telehealth or telehealth modalities be used by RACGP in the same or in similar ways that Akram's able to do it?
Yeah, I mean, I think I can only just reinforce what I said before, Andrew. I certainly have been advocating as the representative for GPs in training in terms of flexible delivery mechanisms for the college exams. I completely empathise with those who are currently experiencing this. I mean, the exams are a source of stress for trainees, regardless of what's happening at the moment. And, you know, to be putting your, as I said before, your life on hold for months in the lead up to an exam, for that to then be postponed and sort of have to sort of extend and sustain that, you know, that study, and then to still have this uncertainty over your head around, is it even going to go ahead? You know, it's a huge toll on people's, you know, on their cognitive load at the moment, in addition to everything else that's going on in their lives with the COVID-19, both professionally and personally. So yeah, I really acknowledge the challenge. I don't know that makes anyone feel better, other than just wanting people to know that I hear you, and I'm doing as much as I can in an advocacy space for GPs in training to, as I said, to try and call for more flexible delivery mechanisms. And certainly that, you know, that is being considered. And I wish I had more information to give to you tonight. Unfortunately, I don't. We do have an exam. Sorry to do a little cross promotion. We do have an exam webinar scheduled for the 6th of May, specifically looking at the AKT and KFP exam. There's going to be one planned for the end of May. This is obviously RACGP trainees, not Akram. One for the OSCE exam later in May, and that will look at giving you know, some updates with regards to sort of planning and scheduling. So I hope that we can give some more information by the time those roll around, and I'd encourage any exam candidates that are affected to sign up to that, and also keep your eye out on sort of the updates that are coming in terms of those exams.
Thanks, Krystyna. And yeah, difficult questions and really difficult to answer because it's just a very complex situation. But I'm now sort of, again, back to both yourself and Allison around allowances for training time or flexibility around eligibility to sit exams or to complete training. Is there any room to move on that? You know, where trainees are almost there and then the impact of COVID means that they're missing out in terms of eligibility or completing training by a matter of weeks or so. Is there any flexibility there, do you think, from a college perspective?
Yeah, I'm happy to talk from a RACGP perspective. I know we're sort of running short of time. I would encourage anybody in this situation to jump onto the COVID-19 information for GPs in training FAQ website. This is specifically outlined in there. Obviously, to be eligible to sit as an AGPT registrar, you need to have completed GPT 1 and 2, and for an RVTS registrar, you need to have completed 12 months of GP terms. But we have allowed for a special sort of COVID-19 related allowance. So if you're slightly short on that because of a COVID-19 related disruption, so, you know, leave that you had to take specifically related to COVID-19, then there will be some flexibility and there will be the ability to still enroll and sit the exam if it's within 28, if sort of their completion of training time is within 28 days beyond the scheduled date of the exam. So there's about a 1 month leeway for those registrars specifically in this situation.
And Allison, in terms of sort of flexibility that Akram's able to offer around either eligibility to sit exams or to progress through training, is there scope there?
I think, Andrew, the main difference is this year we were planning on implementing the MCQ to be a hurdle before completing STAMP's exam, aligning ourselves with many other medical colleges across Australia and New Zealand. However, because of the coronavirus pandemic, we have wiped that prerequisite. So it is possible for registrars to sit their MCQ and their primary care STAMPs exam within the 1 semester, which registrars are doing either this semester or they could potentially do it next semester. So allowing more flexibility in training and sitting assessments.
Thanks, Allison. Just one other question on exams, and then I'll do just 2 more to perhaps finish up on. And thanks everyone for your perseverance, and I hope you're finding this helpful. But on the exams, is there going to be any allowances or provisions in the way the exams are marked for people that are affected this year? Clearly, you know, people's preparation and study and access to patients to prepare has been affected. That plus a layer of stress of the whole COVID-19 situation is just adding to the difficulties that registrars are facing in their the lead into exams. Is there any assistance that the colleges can offer around that in terms of the way the exams are marked or the way registrars are supported in the lead up or after the exam? So perhaps Allison and then Krystyna.
Thanks, Andrew. Akram will continue to provide online assessment preparation assistance for all registrars, and they have also released recently some new online education modules that are free for registrars, specifically targeted at preparing for the big exams such as MCQ, primary care STAMPs and case-based discussion. So you can head to the Akram website to find those links. Connected Akram, our online platform connecting registrars and trainees across Australia, is also also a really fantastic place to find not only assessment preparation resources and study buddies, but also other trainees and other fellows across Australia for kind of moral and psychological support.
Thanks, Alison. Krystyna, how about RACGP?
Yes, similar to Alison, we do have a range of exam support material that's available, and I'd encourage any exam candidates to be accessing these, the exam support online, and the exam support that's provided by their RTO, as well as I guess I'm mindful of the fact that some of the face-to-face exam preparation workshops have obviously been cancelled, but we will look to be able to hold these in non-face-to-face options, so that trainees and candidates will still have the ability to access these supports in the lead up to the exam. I think this person asked specifically whether there's going to be a difference in examination marking. That's certainly not something that I've heard tabled at this point. I think we will endeavour to help to support trainees to be able to get through their exams as much as ever, and acknowledging the challenges that are there, but in terms of actually changes to marking processes isn't something that's on the table. I would, though, encourage any trainee that really feels underprepared, I guess, or inadequately prepared, especially if there's been impacts from COVID-19 in terms of, having to take extra leave, or, like we talked about earlier, reduction in patient numbers, to start talking to their RTO about options that would, potentially give them the ability to extend, have an extension if they didn't feel ready to sit their exams.
Thanks, Krystyna. Question for Mel here around the NTCR. Does the NTCR still stand in the current situation, due to the COVID-19, or, does it fall by the wayside because practices are struggling to keep running and keep working as a business? How does it all fit together, and can registrars still rely on the provisions in the NTCR despite the difficulties of the time?
The short answer is yes, it still stands. It is still a condition of accreditation of community general practice that they must employ registrars in accordance with the NTCR, and any contract that you have signed is still valid unless there is an agreement to change that. So absolutely, registrars can still rely on those standards as a minimum. That said, there are certain realities of the current situation in that many practices are really, really suffering financially, and it is making it very difficult for them to perhaps operate as normal. And as I've already discussed, many of them have made some pretty significant requests of their registrars, and at times there haven't been requests as such, in terms of limiting registrars' ability to work and earn an income. And the reality is that for most registrars, they have very little practical ability to negotiate in those situations. So I think it is important to understand your rights and what is written into your contract that must be upheld from a legal perspective. But it's also important to be cognizant of the realities of the situation and think about the bigger picture and how you can best negotiate this time in terms of your long-term goals. So, and that may require a little bit of give and take. It may require helping out your practice a little bit. So where practices may be struggling because practices themselves and all GPs are feeling somewhat overwhelmed by the current situation. So where practices have had difficulty perhaps pivoting to a telehealth model, this might be a really good time for a registrar who's perhaps a little bit more across the issues and the technologies to maybe take a bit of a lead and do some research and perhaps become a bit of an evangelist to help your practice. And I've certainly seen that some registrars have done that quite successfully and been able to engineer a situation that works for both them and the practice ongoing. I think it's important also to help your practice out and, you know, remind them to do things like apply for JobKeeper, work with them to look at ways you can optimise patient consults. So think about things like sending out reminders for appropriate chronic disease checks, follow up with patients, think about ways you can really be helping the patients and, you know, as a kind of happy side effect, perhaps the practice's bottom line. So there's certainly things you can be doing there, and perhaps looking at other ways you can help out the practice and make it worth their while financially keeping you there. So perhaps there are other activities that you can take part in during your working hours in the practice, like, you know, doing some quality audits and things that will help with practice incentive payments, or doing other activities around the practice. So the bottom line is, yes, NTCER still applies, such as it is. We all know it has its foibles, but think about the reality of the situation. Reach out for help if you need it. There's certainly your RLOs and GPRA here to help you kind of navigate the uncertainties around employment at this time, but also think about the bigger picture and how you can get where you want to be in the long run with the least possible pain.
Thanks, Mel. Look, Sama, I'm not going to let you off the hook. I know you've been sort of sitting there nodding in agreement with much of what's been said by the other panellists. And we've talked tonight about exam issues. We've talked around issues of training progression. We've talked around employment issues. All of these things are being significantly impacted by COVID-19, and the impacts are largely adverse for GP trainees. Can you give us a flavour of what GPRA is doing in this space to advocate on trainees' behalf, and what some of the outcomes we've been able to achieve?
So thanks, Andrew, and thanks for not letting me off the hook. There are a couple of key things I think we've been doing. One is information gathering and narrative gathering, and number two, translating that into appropriate policy making and changing the philosophy around how we actually look at general practice training and support trainees. Our perspective has always been around making sure we have data to support what sort of outcomes we're aiming for and measuring for. And our recent survey has demonstrated a marked drop in terms of the training hours across the board for general practice registrars, regardless of where they are working. That's felt harder in certain areas, but across the board there is a drop in hours. There's also a lot of qualitative data around the fact that people are finding their training experience to be less satisfactory than it was before. And that's due to the reduction in hours, the change in terms of their employment arrangements, the kind of work that they're doing now, the transition to telehealth and the administrative and bureaucratic impacts of that, as well as also the reduction in patient numbers across the board, and what many registrars perceive to be a decrease in the diversity of the practices, of the cases that they see in general practice. And diversity is one of the things we really hone in as being one of the core facets that are important to general practice. So what we've been doing is gathering some information and advocating to various stakeholders, including the Department of Health, around policy changes and making sure that there are flexible training arrangements, flexible application of leave policies for registrars to ensure that we're not eating into category 1 or 2 leave unnecessarily, and making sure that that exists separate in this situation, certainly advocating to other powerful trainee advocates such as Krystyna and Allison around the excellent work they've been doing around exam, training and supervision arrangements within the RACGP and the Akram, and certainly trying to make sure that we have tripartite discussions around what's going to happen, because the impacts on general practice training from COVID-19 stretch across the board, regardless of whether you're an RACGP trainee, an Akram trainee, whether you're an AGPT or independent. It's something that affects everything across the board, and everything from the lack of remuneration and patient numbers to the actual quality of your training experience is a trickle-down effect that affects trainees, I would suggest, first and foremost, and must be rectified first and foremost. What we've also been doing is trying to make sure that we have some practical supports for trainees, such as the working from home documentation to ensure that WH&S standards are met within the context of working from home, to make sure that there's no issues around accessing things such as work cover and appropriate supports if necessary, and also making sure we've been having real conversations to the Department of Health, the RTOs and the medical media around remuneration, and expressing to them that COVID-19 is not the sole cause of the issues that general practice registrars and trainees are experiencing. COVID-19 is the pointy end of the stick and is exacerbating historical problems and long-standing issues that we've been fighting hard for to rectify from a general practice training standpoint. What we're advocating for is ensuring appropriate remuneration, at least on par with our other subspecialist colleagues, and ensuring the employment arrangements around what leave you can access and flexibility in training is something that actually matches our colleagues. And I'm quite confident that the work we're doing, and certainly in tandem with the excellent work that Krystyna and Allison are doing as well, will go some way to achieving this. But we're always open to registrar feedback around what registrars need, what trainees need, and what they think can be done better.
Thanks very much, Sama. Folks, we might leave it there for tonight. Thank you all for participating. Before I wrap up, I'd just like to remind you that if we haven't answered your question specifically, please, we'll be putting up a screen now where you can contact, there's some contact information. So feel free to contact us through those email addresses or through the GPRA inquiries form. If there are specific questions that either haven't been answered or that flow from the conversation we've had tonight. Also, there's been a range of resources that our panelists have been dropping into the chat box tonight. We'll collate them together and distribute them to you as a follow-up to the webinar. Just also remind you of some upcoming webinars that GPRA has. In particular, next Wednesday, we're looking at we will be running a webinar on some classes on wellness and relaxation. So some practical classes that are free for you to access if you would like to have some support in that area. So just to finish up, I'd just like to thank Krystyna, Mel, Allison and Sama for participating tonight, for answering your question. And again, apologies if we didn't get to answer a specific question that you asked, but I thank you all for your participation and wish you good night, stay safe, and all the best for your training despite the challenges that the COVID situation is bringing.